Huddersville, lift your voice and worship Him. He's the awesome God, the soon coming King, the Alpha and the Omega. Lift your voice, everybody, yeah, yeah, yeah. Awesome God you are, awesome God you are, awesome God you are. A binti so awesome God you are, awesome God you are, awesome God you are. Oh binti so everybody say, tell Him how awesome He is in every season. He alone is worthy. Tell Him how awesome. Oh, oh, awesome God. A big child, so mighty. You are mighty God. You are mighty God. lift your voice in this room and say, Father, worship to you when we have no words to say. Oh,
when we have no words to sing, we cry out and say, oh,
we cry out. Sing it again, sir. My worship, I give it all to you. Thank you, Jesus.
Hello, everyone. Welcome to your favorite program, The Inside View with Nana. I hope you've all had a wonderful, Saturday, and looking forward to the following week. I'm so excited, to educate people on this important topic, breast cancer, that is taking, many lives. For nearly 4 decades now, the country, this country, and also, many countries, have recognized October as the National Breast Cancer Awareness Month, and it's also a time annually devoted to educating everyone about breast cancer, including metastatic breast cancer, and the importance of early detection and access to timely, high quality care. And to help me do that, I have with me Julie Hodgins, who is a qualified radiographer, and she's worked in Ireland, Australia, and now in West Yorkshire, where she specialized in breast imaging. She's already a breastfeeding supporter, and also cares so much about women and their health. She has co-authored research into the use of social media in medical establishments and for connecting with the women, also on Facebook. She has also co-authored a digital book on digital mammography, exploring the challenges and the benefits of skilled practitioners to support women from all cultures and communities. Digital mammography, a holistic approach. She's also an active member of a group to support Asian people who have had and are affected by cancer. This started in Manchester with a radiologist who has a passion to support more Asian people to present earlier with cancer symptoms. She's also supported women groups here in Bradford, and she's also, being Slow Together members. I know, in spite of the challenges, she does that to reflect, not to reflect the number of women from that community that has been affected by this disease. And she also volunteered with Re-Engage as an activity group leader. And aside that, she loves traveling and crafting. So let's welcome Julie Hodgins.
Thank you very much for that.
Yeah, such a beautiful bio, and to volunteer. It's really touching to be doing this just to support women. Julie, welcome to the Inside View tonight. And, we are so privileged, to have you, because I know you're a very, very busy person. So just for the sake of those of us watching us, for the first time, if you can just share with us who Julie actually is before we go into today's tonight's discussion, please.
So who am I? I'm a real woman. I'm coming towards the end of my working career. So I get the pension next year if I want to, but I love my work. So I'm not sure that I'm going to retire just yet. And what has been so lovely is getting out and in the community and speaking with other people. I'm not a stick to the copybooks. I'm not a stick to the journals. Yes, we read the journals, but sometimes when we read facts, it's trying to translate that into real world.
Yeah.
And I think I am good at translating stuff into the way that somebody else can understand it better. One of my favorite things is everybody says, oh, you need to exercise. And when I hear that, I think, oh, I must run a marathon. There's no way I'm going to run a marathon, but I might be able to walk up and down my road. I might be able to walk up and down my stairs. I like to bite-size things into manageable pieces. And sometimes I do practice what I preach.
Before we go into today's, tonight's discussion, I just want to, tell my sponsors, my dress was given to me by, Glitz and Glamour, and also my makeup was also done by Milk and Honey. And so if you need, makeup for any occasion, please don't hesitate to call her on her number, which is 07496 318 713. 07496 318 713. And trust me, she will look after you very, very, very well. And her name, once again, is Milk and Honey. Yeah. Julie, why are you an ambassador for breast cancer and women's health? Yes.
So what we know, a couple of things. I enjoy my job. I enjoy when I've been working as a radiographer and you're out in one of those mobile units or working in a clinic in the hospital, you meet so many different women. And even though we're only with them for such a short time, we share stories between ourselves. And I just love that interaction with other women and how we can just, I can learn from other women just while I'm x-raying them. And in the end, the job I'm doing, I might actually save somebody's life in those few minutes when I take a really good image and she can come up, she then gets a result that we can do something with. But really, what I've learned is in some communities, many women and maybe the men are not so sure when they should go to the doctor. In this country, we're lucky that the doctor is freely available. And I know people come from places where they have had to pay or had to travel for long distances. But with this medical imaging, doing a well person check, we can find a cancer that's maybe only that small, like the tip of your finger. But sometimes if we know that in some communities, most of the most of the women who present with breast cancer tend to present with a later stage, whereas we would like them to present at an earlier stage. So the statistics show that in the white communities within the UK, the majority of cancers are diagnosed at what we call stage 1 and then stage 2. In the Black African community, the majority of cancers are stage 4 when the lady presents. So that will have an impact on the outcomes and the treatments that are available. So the earlier we can get you diagnosed, the better. And like I say, many of us go to the dentist when there's nothing wrong. We like to get a checkup. If we have cars, I take it to get it serviced every year. And I'm hoping there's nothing wrong. And that's what we want people to do with their bodies, get them serviced regularly so that we know they're okay.
Wow. Even one is watching us online. Tonight's discussion is really, really, really important because it's, claiming a lot of lives.
Yes.
Needlessly. So please, I want everyone to share this conversation. I know most of you have sent in your questions, but could you please also share this conversation to go very, very far, just to save, more lives, just to save the lives of our mothers, our aunties, and even now, even the young girls as well. So please do not keep this conversation to yourselves, but please share and let this go far, especially in my community. You just rightly heard, Julie. Most of the times we get to see our doctors when it has really final stages and becomes very, very difficult to treat. So please, this discussion is for every woman.
Yes.
It's for every woman, whether an Asian woman, a Black woman, a Caucasian, it's for every woman out there. So please share and let us save lives. Let us save lives. Thank you. And so Julie, tonight, I want to know what at all is breast cancer.
Say that question again.
So what at all is breast cancer? What is breast
What
cancer?
is breast cancer? So an easy way maybe to describe it is it's just for some reason, some small cells in the body decide to not listen to the commands. And what they do is they get bigger and they generate and they keep multiplying so that the body usually can control a growth to stop it getting bigger. But with the cancer, the phrase is that that control is gone so that it can keep growing, and that's when it can cause us problems. So it's most common in women in the breast, it's less common in the ovaries, but it's also in the uterus. But you can get it in your bones, you can get it in your brain, anywhere. And sometimes they grow in a place where we don't notice them until they are bigger. Sometimes they grow in a place where we get a symptom very quickly. And we can't stop them, but what we can do is we can reduce our risk. And it's just part of life. I mean, we are designed to be cells in our bodies. There's always cells changing and growing. And just sometimes the mechanism to control that growth goes out and stops working.
So what really causes breast cancer?
Well, if I rephrase it in another way round, to reduce your risk of breast cancer in particular, but of most cancers, is exercise. So keeping up with exercising, keep moving, can be as simple. The government says we need to move at least 30 minutes, 5 days a week. So 150 minutes. Now that doesn't have to be all in one go. You can spread that over the 7 days. That can involve walking to church. That can involve walking up and down your stairs at home, or even for somebody who sits on the floor getting up and down. Though that is movement, that is exercise. So keeping up with exercise. The other one to help reduce your risk is a healthy BMI. So that's a difficult one. Sometimes when a guideline's sent out, it's difficult to understand. I have a friend who was deemed obese, but she could run a marathon. So that was a healthy BMI for her. So a way of thinking about it is, if your weight is such that it doesn't stop you doing anything, you've no joint pain, and you've got lots of energy, your BMI is healthy. And there are guidelines. You can go onto any website or on your mobile phone, and that will give you an idea of what your BMI is. So it's exercise, healthy BMI, and that goes with healthy eating. So what's healthy eating? For the older ladies, smaller portions, and lots of green veg, a lot more vegetables than probably some of us do eat, and less processed food. So it's okay to have those special treats, but not every day and not every meal. And it's just learning to be kind to your body. We also talk about if a woman chooses to or is able to have babies, breastfeeding is a really good way of reducing your risk. But again, that is not always open to everybody. And in some communities, that's much more the norm to breastfeed. But we do know if you breastfeed for longer, it reduces your estrogen level. Therefore, that reduces your risk as well. Then there's the standard smoking and drinking alcohol. If we can keep those out of our bodies, that means we have a better chance of reducing our risk.
Great. So usually, many a times we don't even want to hear the word cancer or even the letter C in our conversations. So how can we start these conversations or raise this awareness in our communities, like in our workplaces? How do we start this conversation so that it becomes normal, especially in the minority communities? It's a kind of conversation we don't even want to, have or even hear of the word cancer. It feels like, you've been given a life sentence. You know what I mean?
Yeah.
How do we bring this, this taboo, where if there's such, a thing, how do we do that?
I think the easiest way is that we should all be talking about it. So for people who are affected by cancer, if they can talk to their friends and family. So that could be you or me who knows a friend, and we should say to other people that, well, I do have a friend. She was only 38, but she went and got checked and she's doing well now. I have another friend who was 50 when she was diagnosed, and she did well for 10 years. So, that was really good. And she lived a really good life for 10 years, but her life has been shortened. But she has done so much work to try to get other women to be aware of these early signs and symptoms. And so I think it's getting women to talk about it. It's getting, and the more we talk, like for me growing up, cancer was a capital C. And I've now learned it's only a small c. And that's because we are much more aware. We've more research, we've more better treatment options now. And maybe in 30 or 40 years, the treatment will be different again. Chemotherapy for cancer can be very hard on some people. And maybe in the future, that treatment will change. But right now, that's the best we have for most cancers. And they're so different. But I think it's talking about it. It's teaching our daughters to be aware of their bodies, and not in the social media way, but in just understanding what's normal for them. I get a lot of women who say they didn't understand when their period started, that their mothers, their aunts hadn't spoken about that. And I still think that happens in some communities now, even in my own. Some women, is it for some people when, well, I managed and I didn't have any issues? Or is it, well, actually, you're really lucky you didn't have issues, but many people do, and it's accepting that we are all different. Menopause is still exactly the same. People have not talked about it, but now in the last few years, people are talking about it. So it's becoming more normal, which I think is great. Some women I've come across who said, oh, I don't know what everybody's bothered about the menopause. I had no problems. It's as if she thinks that the other women are making it up. Whereas I'm sure all of you listening today know somebody or have experienced yourself the symptoms of menopause. And they're not easy for some people. So by talking about it, and in a positive way, because there's so many people living with cancer now, and yes, there are some dying with it, but the earlier we can catch it, the better the treatment options we have, and we have a better chance of extending life. Many of us are great believers in the faith, and we have a strong faith, and the faith allows us to experience other treatments alongside our faith, rather than some people interpret faith meaning I don't need the treatments. And I think that's where things can go a bit wrong. I think any greater being wants us to help ourselves, and then they will help us. But just relying on one course of action on its own may not be enough to get somebody through a treatment. And it is the power of faith when you have, if you're feeling down because you're having horrible treatment, but faith will get you through it,
Wonderful.
I believe.
You know, you speak to a lot of women, and they find it difficult as examining their own breasts, especially those of us with huge breast. Sometimes it can be a bit difficult to examine your own breast. So, if there are any ways that maybe you can teach us how to do it, and also what are the signs that people should look out for?
Okay. So we've been talking for a few minutes. May I show a video that might just answer some of those questions? So help me. Let's have this see. As with everything, it worked beforehand. Let's try it again. So share the screen. Share screen. And this is from a charity called Copperfield. And it's going to go play now.
Boobs, what are you saying? Size and shape looks the same? Thickness and lumps? Nope, nothing new. Skin texture, nice, looking good. Pits, collarbone, no swelling, feels the same. How my lips doing? No discharge, inversion, any pain? Nope, we good.
So that is, let me stop sharing before I start talking. Switch that off. Okay. And am I back? I'm back, I believe. Lovely. So that was really quick, and it's short and snappy. Copperfield aims at working to try to educate the younger women. But hey, I'm young at heart, and as you are, as everybody listening tonight is. We're young at heart, so we are. So what she's talking about, so this is my own lovely knitted boob that I like to share. I better keep it in front of my face, you can see. So things to look out for are nipples. Is it sticking up? Is it flat? Is it inverted? If it's always been like that, fantastic. That is normal for you. If it starts to disappear in over 2 or 3 weeks, that is not normal. Okay, so that's why in the video they talk about always checking once a month. And people say, I'm in the shower, I can do it every day. Can you see your hair grow every day?
No.
No, but over a month you might see it change. And so that's why we ask you only to just check your boobs once a month, maybe every 2 months. My birthday is on the 11th. So on the 11th of every month, I give my boobs a good check to make sure I know what is normal for them. So other things to look out for, obviously, is a lump. That wasn't there last month. It's a problem. I need to phone the doctor. A dimple. Now, I always say babies can have dimples, but boobs should never have a dimple. And and it can be a very slight indent. So if you were just even looking at your boobs, if there was just a little indent there, that would be, it wasn't there last month, therefore I need to get it checked out. We can have skin changes. So I like to say sort of, if you look at the skin of your arm, it's smooth, but if it had little creases or dimples on it, wasn't like that last month, get it checked out. Or by just having a good feel. So when you're in the shower is a great place to check. As you're right, a bigger lady might need 2 hands. I only need 1 hand. But that's the way life is. This is the one occasion when it's small is good. So 2 hands. They don't have to be your own hands, of course. You may have somebody else to help you check. But, we're all different. We'll all do it different ways. But when you're in the shower, put some soap in your hands and give them a good rub. Now, it's not like stroking the cat. It's a proper push down and have a really good feel, okay? Now, you're right, for a bigger lady, she might find it easier to lay down in bed with her arm behind her. And then she's doing is pressing her breast against her chest wall. So she's a better chance. I mean, this is a knitted boob. I can feel it like this, but you can't do that with your own boob. It has to be with your hand and a good feel. So what I say is, the way you get up every morning and you look at your face and you go, aren't I gorgeous? Or Oh, I need to go to bed earlier tonight. We know what is normal
Yeah.
for our faces. So what I'm asking women is know what's normal for your own boobs, in fact, your body. And if something wasn't like that last month, that's when you need to get it checked out. So you and I think we're happy to touch our breasts, but some ladies aren't. So that's another way. So again, sometimes we've been brought up normal for our culture where you don't touch your body so well. And so another way to do it, and it's a little bit hard on this small screen, but imagine I'm in my bathroom, standing in front of a mirror. I've locked the door so nobody's coming in, and I take my kit off. Okay. And I've got nice bright lights on, and I'm just looking at them. I'm looking at how they hang. I raise my arms up and I'm looking, and then I go sideways and I'm looking, and I go sideways again and I'm looking, and then I put my hands on my hips and I squeeze and lean forward, and I'm just looking at them. And if I'm bigger breasted, I need to lift them up and have a good look underneath here. And that just means I know what they look like. And another thing, like sometimes if people are lumpy breasts, they're again scared to touch because they don't know what they're touching. Look, just know what's normal for you. And then you have a better chance of spotting something that isn't quite normal, that isn't, it wasn't like that last month. I better check. And we're much happier that you ring and get an appointment. If you ring your GP, and don't all laugh, but you will get through, do say, I have a new breast symptom. You will be seen by the GP probably the next day or the day after, and then you will be referred to the breast clinic at your local. So in Bradford, it will be St. Luke's, and you'll usually get an appointment there. We say within a fortnight. It's often within a week, and we would much rather you came and we checked you out and we said, yeah, everything's okay. That's normal for you. Or just a cyst. It's nothing to be worried about. Rather than you sitting, there's nothing worse. The lovely phrase is wasted worrying. There's no benefit for wasted worrying.
So usually, does certain bras cause, breast cancer?
That's a myth. That's one of those lovely myths. Bras can be comfortable or uncomfortable. I'll get my lovely knitted boob again. We often get ladies in, they'll come in for breast screening and they say, oh, the side of my breast, it's really sore. And when we look, we just notice that it's just the wire from the bra that has now just been sticking in. So what happens is sometimes, many of us wear wire bras, quite okay, but sometimes we try to squeeze our boob into a wire that's too small, and therefore then the wire is here instead of back here, which is where it's meant to be. So if you've got a proper underwire bra, it will be right at the back here. This is really good fun for me because my image is backwards and I keep getting confused. But know yourself. If your bra is right, it'll be right to the back here and it'll be all right. Another way of knowing, is this the right bra? Can you leave it on all day? Or do you need to take it off when you get home? If you need to take it off when you get home, it's not fitting well. And it just means it's uncomfortable. Smaller breasted ladies don't need to wear bras. Bigger breasted ladies probably are more comfortable. And some people would say the heavier weight, then it needs to be lifted. But I'm sure those of you that do have heavier breasts, trying to find a bra that doesn't stick in, you need to get ones with the really wide straps up here. Yeah. So bras don't cause cancer, but they can cause symptoms of pain and discomfort, which then people worry about. And then we always tell ladies who are pregnant not to wear underwire bras. And that is, again, primarily because so many people wear bras that don't fit as well as they could. And that may restrict just fluid flow. When you're pregnant, there's a lot more blood circulating around your boobs. And again, some people say it might cause a problem. So that's why they said that there isn't a lot of research in that. But generally, bras should be comfortable, and yes, they shouldn't be 20 years old like I had in my wardrobe and I had to throw them out. I did practice what I preach, but so I often say to ladies, what's the oldest bra in the room? If you went home and you looked in your drawer, how old is the oldest one in there? Just for fun.
Just for fun, yeah. So, at what age is breast cancer?
Right. So you're never too old to get breast cancer, but the majority of women are over 50 in the Caucasian community. It would be over 40 in the Black community. So that's why breast screening starts at 50 in this country. In America and in established places in Africa, screening is starting from 40. But in the UK, we haven't quite got there. Because it's not, when you have a screening program, it has to be one set of rules. So you wouldn't be able, the system would find it difficult to start some ladies at 40 and some ladies at 50. So we compromise. We promise currently to invite you once for breast screening before you're 53. But I'm hoping in a few years' time that will move to, we promise to invite you once before you're 50. So that will lower it down a bit. And so if ever you go with some breast concern, a new symptom or something you're not concerned about, and somebody says to you, you're too young, please say, I'd like to be referred anyway. So, and I think that's one of the things that women get caught out, and men. Well, I've been to the GP and he or she says it's fine. If you're still worried about it, go in 2 or 3 weeks, go back again and say, this still is persisting. I'm worried about it. I would like to be referred. Okay, you can ask, it is okay. But the majority of people go to the GP with breast pain, breast lumps, and it's just hormonal. But we don't know until we've had an ultrasound. We're happy to check. It's much rather that we get people and we can reassure them that it's okay. Majority of ladies are over 50. In the Black African community, that would be over 40, but you can get it at any age.
Today is my first time of getting to know that Black people are at a higher risk of getting breast cancer than any other race.
At a younger age.
Yes, at a younger age. If anyone is watching this interview, please, I am begging you tonight. I am literally begging everyone tonight to tune in, bring out our young ladies, and also share this conversation, because I am stunned. I am a bit concerned as well. So please share this conversation and let it go far. Because knowledge is power.
Absolutely.
We cannot continue to pretend as if, the letter C or the word cancer does not exist. It is. And for us, the better we get informed, the better we can ask for better treatment.
Yes.
So
yes.
I am begging every lady online to, partake of this conversation. And if possible, send in your questions, because I know, most of you have done, but I'm still, begging. I'm begging, honestly. Please send in your questions and let us all join in. And, together we can save lives. Together we can save lives.
There's some really good stories. I don't know if anybody watching tonight watches Strictly Come Dancing. I don't know if that's, So, and I've forgotten the name, but one of the ladies there, I think from the last series, she just happened to be on a Copperfield walk. She'd never thought about checking herself. And it was only just by talking and listening to other people sharing their stories that she checked herself and discovered she had a lump. I think it was a lump she had and is now having treatment. But that's probably saved her life by listening to other people talking.
Yeah.
And women, us women, we are great talkers. So let's talk to our friends, and somebody might be listening who actually will learn from what we're saying. So we don't have to be talking to the right person. And I've come across so many ladies who said, well, my sister, my friend was worried about me and said I should go for a checkup. And I'm really glad she sent me. So many times I've heard that by women only coming because their friend or their sister encouraged them to go. So it's brilliant. The power of women talking, sharing knowledge is amazing.
You see, tonight, instead of just talking about clothes, makeup, and stuff like that, let's talk about breasts. Let us talk about our own breasts. And I think, we can save more lives. So, Julie, I mean, if somebody comes to you, I'm not too sure, or has been diagnosed of cancer, what advice would you give to that newly diagnosed woman?
Newly diagnosed women, she will be well looked after by a breast care nurse. All of the hospital settings now have in the UK. So again, please, others may have to share with you for other countries. But I think generally there will be a breast care nurse, another woman who is specialized in this area. And she will give you a phone call, which you can ring, leave a message, she'll phone you back. It is exercise is the big thing. And again, I'm not talking about a marathon, but while you're going through treatment, eat as well as you can. And it's hard sometimes if you're feeling really tired or sick, but find ways that you can. And then if you can just go for little walks up and down, can you just take that vitamin D from the sun if it's a sunny day? But those little walks, those little things that you enjoy doing, and maybe you haven't got the stamina to do them forever, but maybe you can just do them for half an hour where you've got that energy, and then you feel like you've achieved something. And the other thing we really, really know works is meet up with other women. Sometimes if you're feeling quite poorly, you're not able to go somewhere, but we are so lucky with social media now. There are many groups online. Okay, some groups may not suit you. Please leave them. But there may be groups where you just find another woman. I heard a lovely story where about a girl recently, and she'd been on in a group and she didn't like it, but she actually engaged really well with a woman in America. And so she chats regularly online with this woman in America because they feel they are very similar in their stories. And it just makes you feel not alone. So reach out as a newly diagnosed person to others who might be maybe just a little bit ahead of you, because then you can see that actually it's going to be okay. There are bad days, but there are going to be more and more good days. And this is the way it is for a lot of people. For some people, treatment was never going to work. Some cancers don't give you that choice. But still, where there's hope, where the sun shines, where you can just enjoy your faith, there's plenty of good days to look forward to. And for somebody who's come to the end of their treatment, where usually it's about a year or 18 months, and suddenly they say, right, okay, thanks very much. You've had your last checkup. You're all right. We'll see you again in a year's time. And that can be very scary for a woman. That's really like, oops, I felt more confident while I was seeing somebody regular throughout that treatment stage. Now my treatment's finished. I'm just having a checkup every year, and it's really scary. And that's another really important time to reach out and join a group, which is why in Bradford we have we call it a South Asian, but women's cancer support group. Maybe it should just be an Asian women's cancer support group. And again, it's for women just like me. And maybe that's something, Nana, now that maybe we should be looking at something for Black women, because I don't know if there is one.
Because I was just about to actually raise it up. I mean, because since you have one for the Asian community, can we also have one for the Black community as well?
So we need somebody who's interested to run it, because I'm the wrong person. I'll help set it up, but we need a place and 2 people, because then it's much easier to do something when there's somebody to share with you rather than doing it alone. And we find a place where the women are already going. It's easier to go. Women's Zone is popular in Bradford, but there might be other places that are more comfortable to go, where we can get a venue for free, because that's the big challenge. Kind of, a group of women, you could meet in a cafe, but again, sometimes people aren't able to share because it's in a public setting. Sometimes it's better in a private setting. But that would be a great outcome from this chat today.
I think we have to talk behind the scenes and see how best we can support the Black community, because since we are not too forthcoming with information, and also not also wanting to know, I think we also need a center where people can feel confident and come, want to share their story, and also to seek better treatment as well. What are the signs, especially for the Black community, where we don't, we don't even talk about it at all, but then we get to see our doctors when it's in the final stages? What are the signs that the breast cancer has spread?
So signs that it's, start with the bad news. Sometimes a cancer just quietly grows away, and by the time you have some symptoms, it's already spread. That doesn't mean it still isn't treatable. So, and you can be looked after. We can slow it down. And again, cancer is always deemed a life short limiting disease, but with treatment, we can extend that. For somebody who has had their cancer treatment and then has been given what we call the all clear, or there's no evidence of further disease, they have a higher risk of the cancer coming back, and it can come back in a different part of their body, maybe not in their breast, and that would usually be pain. So we talk about the red flags. So maybe it would be, again, what's normal for you? If it's different, get it checked out. So it can be headaches. It could be pain in your bones. It can be within your abdomen, just a change in pattern of your bowels, or how you're eating and how that eating is affected. So it's knowing you're normal, and if something's different, get it checked out. Again, we hear stories of people where they say they've had back pain, and they'll go to the doctor, and the doctor's treating it with anti-inflammatories or something. But if I'd had back pain and I knew I'd had a type of cancer in the past, I would say, doctor, don't forget, I've had cancer in the past, and I'm concerned that this might be related to it. Because again, not everybody you're speaking to will have gone through if you had cancer 10 years ago, that's going to be a long way back in your notes. And sometimes that doctor you're speaking to might not know that. So it's up to us. We have the knowledge, we need to share it. So it's always telling people, I have cancer in the past, and I'd like something checked out. And sometimes the doctors can reassure us, and we know it's all right because they can check off other symptoms, they know you. But doctors are our first place to go when you have any concerns. And it's know you're normal. And if something's different, the sooner you get that checked out, the better.
Right.
I liken that to, like, I live in a house, and if I look over my ceiling, there's a nice brown stain there underneath where the shower is upstairs. So I know I need to go and fix that shower tray, because that brown stain's only going to get worse And if I leave it much longer, mycelium is going to be coming down, and that's a bigger job to fix than going up and sorting out the leak now. So different ways of thinking about it that are important to you about getting things checked out early. You talked specifically there about Black African women, Black women. Their breast tissue is more fibrous, so it's more difficult to feel a lump. But we can look for skin changes, we can look for dimpling, we can look for indents. Those are the other things that we can look for in our bodies. And that's why sometimes looking, in addition to having a good feel, can make a difference. So check your bodies once a month, please.
So at this point, would you consider genetic testing, for women, and possibly encouraging women also to participate in clinical trials?
Oh, clinical trials, please. Yes. So we have a big problem in this country where we used to only do clinical trials on white men. Well, because with the majority of women were white. So now they know that trials on men alone is not good enough because drugs affect us all differently. So they want more women from all communities to come forward. And sometimes I think there is this myth or misbelief that if I go for a trial, people will think I have the disease. No, that's not it. Hey, I try different recipes. I cook different things, So if you can, please, and it's right for you, do participate in a trial, because then it will make it better for our children and our grandchildren. And I think that's often what we need to be thinking about. It might not be right for me right now, but if what we can learn makes it better for my children and my grandchildren, then I'm all for it. I've done a good job. So yeah, where there are trials. So if you have been diagnosed with breast cancer or any cancer, do ask, are there any trials? And you can Google trials. Just go onto the internet, breast cancer trials, whatever other cancer trials. Sometimes you can do it. Cancer Research UK, CRUK, are a really good site. Macmillan's a really good site. Or just Google it straight. You'll find, and then that's knowledge. And you might be able to bring something to the attention of your caregivers that they hadn't quite heard about. But then they can get you on. That might be something that's really good for you. And trials are all different. And I'm sure there's lots of myths going on about trials and stuff. Oh, you might not get the best drug or whatever. But when you do a trial, you get really well looked after. Somebody's checking you all the time. So some people say a trial is really the best place to be. See how it goes. Genetic testing. So here's a question for you, Nana. What do you think are the two biggest risk factors for getting breast cancer?
I think one, I would say, maybe through genetics and also through what we eat. Like our lifestyle.
Those are lower down the list. If we've talked already, who are the men or women who gets breast cancer most?
Very women.
Women. Now, men do get breast cancer, but very few men will get breast cancer. There's about 55,000 new cases of breast cancer every year, but less than 400 would be men. So if there's a man in your life, do please check out his boobs as well. So being a woman is a big risk factor. And the other one is most of us are over 40 or 50 when we get her. So age is another big risk factor. So those are the two biggest risk factors. We cannot do anything about those. Okay. That's why we talk about reducing your risk with all the other things. So you're absolutely right. Eating healthy, not smoking, not drinking, and exercising, they all reduce your risk. Family history or genetics is the third one, but it's still way down. So a family history only accounts for about 1 out of every 4 or 5 breast cancers. Most of breast cancers are age related and just because you're a woman and you were unlucky, maybe. They reckon maybe only about 25% of cancers are preventable if we had lived a healthier lifestyle. So genetics does play a part, but not as big as what people might think. And so what I would say to a lady is, if you have had a close relative, a mother, sister, or daughter, or father or brother who developed breast cancer, and for the ladies, if they were under 50, the chances are you have an
We sincerely apologize for the technical glitch. We'll get back to you shortly.
Nope. I'm back. Am I back? I'm back.
Yeah.
I'm back. That's the disadvantage of technology, but hang fire, we will come back. So yeah, so if you have a mother, sister, or daughter who was under 50 when they were diagnosed with breast cancer, it does mean you may have an increased risk of developing breast cancer yourself. Then you would go to your GP and you'd ask for a referral through to Family History Clinic. And they will then be looking at your bigger family tree. So again, we need you to be talking to all your other families and saying, has anybody else been diagnosed with breast cancer? What age were they? And do we happen to know what sort of cancer it was? Which most people don't, because do you know the way pasta, there's so many different shapes of pasta. There's so many different types of breast cancer, and they all have a specific name. And they all have a specific type of treatment that will work with them. So it's really a minefield when we do that. But try to find out as much as you can about Aunt so-and-so. She died at 40. And yeah, we only knew it was breast cancer after she died. That's okay. That's something else to know. Or if you have a male close relative who's developed breast cancer, that is also important to know. So you go to GP, they will refer you to breast clinic. And I understand one of our nurses in St. Luke's can do that. Otherwise it's to Leeds, to St. James's, and they will look at your big family tree. They will make an assessment of your risk. And it may mean then that if you are deemed to be a higher risk, you may actually start off with being checked at a younger age, or you may have mammograms more frequently. So it's all depend on that risk factor. So yeah, it's good to know. It's good to talk to find out what else has happened within your own family.
Great. Julie, when we were teenagers, just trying to, during those adolescent age, you find this, I wouldn't say a lump or something in just trying your breast actually developing. You have this a little bit of lump in it, and you grow, and through childbirth, age and everything. Is that different from the breast cancer lump? I mean, how different is it? Like when you grow up, is that lump supposed to disappear? Or
So there's
I don't know how.
So there's two things. As a child at about 7, is a girl child, is starting to develop what we call breast buds. And again, there's some really good information. I can put afterwards. I can put a link to some other links in the Facebook report about it. But it's again teaching your young child, but that is normal for her to have that lump, and it'll probably be on both sides. You wouldn't notice them generally, but it will just be part of the growing process. Further on, around teenagers and through pregnancy, sometimes we can get what we call fibroadenomas. Those are just benign lumps. And again, if you're checking every month or every 2 months, you will notice if something's different. And best thing is, if you're not sure about something, phone a doctor, get an appointment and get referred to breast clinic. And there, again, it's better to be talking to people rather than wasting time worrying about something. Fibroadenoma are no problem, cysts are no problem. There are, if you just think of your own skin, we get lumps and bumps on our skins. They're no problem. It happens within the breasts as well, and we know by the look of them. We know we can sometimes do a biopsy, and then we can be really sure that we know that it's absolutely not going to cause you any problems.
So now, let's get to the treatment stage. What treatment options are available, for breast cancer patients? Or
Lots and lots. There is. Let's start off with the easiest one. Watch and wait. You tell a lady she has a breast cancer. It's so small. It's a low grade. So we've done all the tests. We know what it is, and we say to you, it's a low grade type of cancer. We're not good. We're not really sure what it's going to do, but we could offer you watch and wait. And then after that, then for some people it is a lumpectomy. So again, if you go back to my nice boob, if you present with a cancer that's really small, you might be okay with just a lumpectomy and you'll still be left with enough breast tissue that looks okay. If you have a cancer that showing it's through more breast tissue, and they would take out a bigger, you'd be left with only a little bit of skin and it wouldn't look so good. So it is then, many people feel better just to take the whole breast away so that you're flat chested. Sometimes, depending on the cancer, depending on the woman, depending on her age, depending on her health, all of these things just add into the mix, the recipe to see what works for her. She might be offered an implant, which can go under her skin. Yeah, and this is an implant. It's quite heavy. Everybody's quite amazed how heavy it is, but that's an implant, and that can then go under the skin. Okay, and that will be done on the NHS, so that the lady then can waken up with surgery with 2 lumps in her chest. For some ladies, they don't want that, or it's not an option for them. And so what the NHS will give you is what we call a prosthesis. Again, this is a softer, squashy bit, and it goes inside your bra. And, for want of a better word, it's a chicken fillet to make, some of the ladies might have used those as well, or tissues. It just makes a bit of padding so that when you're wearing your party frock, it looks like you've 2 boobs, if that's important to you. Okay. And at this stage, I'm going to give a plug for Knitted Knockers. So you can't correct, but I'm going to read what it says. Knitted Knockers is a charity where people knit knockers, boobs, for you. And it says, made with love and filled with hope, a gift from one woman to another. And that you can Google them, Knitted Knockers, and they will knit you a knocker or a boob or crochet, and they will make it the shape and the size and the color to suit you. And some ladies like this, some ladies like this. Depends what you want, okay? But they're all available for you. So radiotherapy, if that's what you are being advised is best treatment for you, is usually for 3 weeks, every day, 5 days a week. And radiotherapy means using radiation to burn the cells that are causing the problem, or the area where the cells were. And it can be okay for the first week, and then it can be more uncomfortable the second and the third week, and you can make you very tired. I mean, here in Bradford, you would be having to travel in and out to Leeds, St. James's Hospital, or maybe you would end up at Christie's, depending on where you are. And it's just it's a tiring journey, and it's only a short visit, but it's more time spent traveling. So that can be tiring. Chemotherapy is different for different cancers, but often is 1 day every 3 weeks where you go to a center to have an infusion. So you'll often see images of people hooked up with a drip and an IV, an intravenous way of delivering medicine, and that slowly goes through your body. And yeah, and it works. We know it works, but it can also make you feel really uncomfortable for a while. Again, you can be all right for a day or two, and then you can feel really poorly, and then you start to get better, feel better. Some ladies say like they can work it out the week, on the 3rd week, they can go on holidays and they feel quite okay. So you can manage your life a little bit way. Some ladies can continue to work the whole way through treatment. Some people can. It's just the way it is. So we are all different about how we are affected. So surgery, radiotherapy, chemotherapy, and sometimes then also we can give you therapy just with drugs, just by taking a drug by mouth. That can also be an option, depending on what you want, the type of cancer you've got, and everything else about you. They call it a holistic approach now. Everybody should be getting a holistic needs assessment, which is a fancy way of just saying, looking at all of you and your life, what would be the best for you.
Great. So are there any possible side effects of all these treatments or each treatment?
Absolutely. You might be cured. Really good side effect. So that's the goal in the end. Life is all about benefits and risks. So none of them will cause you, I'm going to say, long-term life-limiting challenges. However, chemotherapy, you can lose your hair. For some people, that is a major thing. You can get what we call neuropathy, where your fingernails can be affected, your fingertips can be affected, as your toenails. So again, sometimes people are, well, that's no big deal, but actually your whole skin is very sensitive. So during treatment, you can be quite sensitive to a lot of things that were normal for you before. But those mostly all will disappear after treatment a while later. But I know some friends of mine say, I still have a bad toenail and it's never going to change. And that can be the result of chemotherapy. And with radiotherapy, if you have some partial breast tissue, it will be quite hard for a while, but it can then soften a few years later. So yeah, but the benefits are that we believe it will cure you, or part of your treatment process.
So, does the breast cancer treatment, can it affect someone's ability to have a baby?
So again, that's where looking at a whole person, and if you've got a younger person who is of childbearing age, then they will have that discussion with their health professional, and they will suggest options. So if you think breast cancer is often estrogen dependent, so it means it liked estrogen. So if that is the way it is for us, then the first thing that the best option for us generally believed is to be stopped estrogen. Therefore, that would affect a woman's fertility. So that's where they can talk about harvesting eggs. And then again, depending what the cancer is and where it is, later on, she might be able to go out and carry a baby, maybe be able to carry a baby or do it in a different way. But that will be an option, and it depends on the treatment and the type of cancer that she has. So I can't give you a one answer fits all.
Okay.
Yeah.
Great. Okay, so if someone decides to not take the cancer treatment, can they seek second opinion?
Yes. So sometimes we don't, when we get a cancer diagnosis, we don't hear. I would say most of us don't hear when we get a cancer diagnosis. And it takes, and I always say to people, bring somebody with you when you go for one of those heavy appointments, because they will listen and write down notes when it, your brain goes off. So by all means, you are very, very welcome to get a second opinion. And you can go speak to different, and sometimes it can just be how I don't like how that person talked to me can make you affect how you feel about what treatment options are being offered. And that's why we have breast care nurses. And then you can always go and get a second. You can on the NHS, you can ask for a second opinion as well. They will offer that to you. If that is what you want, they will try to fulfill that for you. And if you're private and if you're in a different country, again, you can get a second opinion. It can help you understand things better sometimes. And the answer might be the same, but you might feel better then.
Great. I think we've gradually, come to the end of our discussion. But if being the experts in this field, if there's anything they'd want to add, if there's anything they want women out there to know, you give us your final words, please.
Well, I have one more little video to show you, if you can indulge me, about the process of breast screening for well women. Well, when we've spoken to some people who've not attended, they say, I didn't go because I was worried that there might be men there. It's all women for the well breast service. And the other thing was I didn't know what was involved. So again, I'll put another video on, but this is just a short, nearly 2 minutes of just a video about, in cartoons, talking about the breast screening process, about getting your letter. So let me put this up. Present, share screen, select a tab to share, that one. And I should be sharing now. Am I sharing, Nana?
No.
No. Okay, let's go back to here. Choose a tab. Oh, there we go. That one. Done. I didn't read my screen properly. Right, here we go. And I'll put sound on as well.
Is the most common cancer in women, especially for women aged 50 plus. Sadly, 1 in 8 women will be diagnosed with it in their lifetime, with 1 in 3 being over the age of 70. But did you know, if diagnosed early through screening, 9 out of 10 women with breast cancer live? This is because most breast cancers are found early when there is a very good chance of successful recovery. It is really important, therefore, that when you are invited for a free breast screening appointment, you come along, as it is the most effective way of detecting cancer early and therefore recovering from it. So what can you expect from the breast cancer screening program? Well, to begin, every 3 years, women aged 50 to 70 will be sent an invitation letter for free breast screening at either a mobile unit or a screening centre. Inside the breast screening unit, the receptionist will advise patients on where to go for their appointment, and a radiographer will explain the procedure of the X-ray. All our staff are women, and your privacy will be respected at all times, so there is nothing to be embarrassed about. A mammographer will take the breast X-ray, which may be slightly uncomfortable, but only lasts a few seconds, and 2 film readers independently check the X-ray to look for changes in breast tissue. Once done, you should receive your screening results in writing within 2 to 3 weeks. If an appointment has been missed, a second letter is sent out for you to arrange another appointment. That's all there is to it. So remember, don't let cancer win. If you are invited to attend a screening, make sure you come along. It's worth a few minutes of your time.
There we go. So
This is self-explanatory.
Yeah, and what we say to women is, if you're concerned, don't wait for your well woman checkup. That's the same for your cervical cancer screening and your bowel cancer screening as you get older as well. Don't wait to go to your GP. And I have my little lemon here. And this is where I say to you, if you think about it, what's inside a lemon? Now I'm going to ask you, seeing as I can see you on the screen, what's in?
Juice, juices, and then it's called.
What else is in there? Don't worry, everybody panics when I ask them this question. It's a really
in it as well.
Seeds. That's the answer I wanted. Any chance of seeing the seeds through the skin? Is there any chance of seeing the seeds? No. Any chance of feeling the seeds through the skin?
No.
And so a lot of ladies say to us, I didn't bother going for my breast screening because I didn't see anything and I didn't feel anything. Okay. And that's exactly when we want you to go for breast screening or to do one of those well woman checks, because if you can't see or feel anything, that's brilliant. And then by having the check, we can see and just confirm that everything is all right. Because if there's that little lemon seed in there hiding, in the next 2, 3, 4 years, that might develop into a symptom. And it was much better if we caught it while it was only a small disease, rather than waiting till it was a disease that you could see or feel.
Julie, I know I said, I want you to, say your final words, but I think I've got 2 questions that, people have sent.
Okay.
One wants to know, what are the best questions to ask an oncologist when they visit them, especially once they've been diagnosed of breast cancer? What are the best questions to ask?
The best questions are your questions, and write them down. So before you go, you're going to get a diagnosis, and then you're going to be sent away, and you're going to have, say you're not sure, and you go along to breast clinic, and you're going to have a full load of x-rays, maybe ultrasounds, biopsy, and then you have to go back the next week to get your results. In that week, speak with a friend and write down those questions that come to mind. And then whilst you're at that appointment, just make sure that all those questions have been answered.
Great. And I think I've got one online also from Nana Yankee asking, thank you for this educative program. May I ask, what is the least invasive? Yeah. So the only breast screening, well woman breast screening test tool that we have is the mammogram. Okay. A lot of people think, because it's X-ray, it's bad. But actually, this is where we've got to do benefits and risks. So the benefit for a woman over 50 who is having a mammogram, who has got no symptoms, is that we can reassure her that everything is okay. We could see a small disease that she couldn't see or feel. Because she is an older lady, the breast tissue is less hormonal, so she gets a low radiation dose. And we have the systems designed now that the radiation dose is so low. Actually, you would get a higher radiation dose if you were to fly from the UK to Cape Town, or America. And people forget that all the time. And air hostesses aren't renowned for getting breast cancer more than the rest of us. So it's benefits and risks. So yes, it is a squash. We do the squash because breast tissue is full of fibers. So if we squash the breast, we spread the breast tissue out. Okay. Whereas if we just took a picture, the fibers would all be just in a mash together, like a plate of spaghetti. You need to spread them out. So that's why we do the compression. The compression is tight. And then again, there's loads of myths around why it is, but actually the majority of people who attend, and at least 70 to 80% of people in the UK attend regularly for the breast screening. So lots of people are doing it, and they have been doing it since 1988. So it's well established in this country. And what it does over those 20 years, you'll probably get 9 x-rays. So the radiation dose is still very small, way less than a CT scan. And some people don't worry about CT scans.
So it is the least invasive because it doesn't break any skin, and it gives you a very high quality result. And it's free in this country, but you might have to pay for it wherever you live. Sorry.
I hope, Julie has been able to answer your question, Nana Yankee. And also I have FAJ also saying this is very, very informative, gaining knowledge and educating one another and supporting each other. Let's be brave to talk about it, especially in our communities. Sometimes it is all about being empathetic, with people going through it.
Yeah.
And
yeah, sometimes ladies don't share that they're going through it, but you might know your best friend. She just maybe needs a hug. Or what I heard is lovely said, "Oh, my friend just rang me and invited me out for a cup of tea. She didn't ask me how I was. She just said, let's go out for tea."
So now when we talk about, breast cancer awareness, what
I
would you
want-
say about, before we go?
Yeah, I want to talk about breast health awareness. Let's talk about being aware of what is normal for us, and the majority of us are going to be fine, and we'll get to know our boobs really well, because in the end, you will know your own boobs better than anyone else. So you get to know your boobs, get to know your body, know it well, and if something's not right, get it checked out. And then, therefore, we're more likely to spot things at an earlier stage rather than waiting until they're more difficult to fix or maybe not fixable.
Thank you so much. We had, the Lord Mayor of Bradford, Bev, online watching us, and we'll say thank you. Thank you so much, Lord Mayor. Beverly Malani, we say thank you for supporting us and also for joining in tonight's discussion. We appreciate you so much because we know how busy you are, but then for you to stop by and join in tonight's discussion, we say thank you. And to everyone that is joining tonight, from Margaret, from Frank, and from FA, and many that sent their questions, I say thank you. Thank you so much. And can I address my own community? I am begging you tonight. With the statistics, the information, and I mean everything. It's out there, and we've been educated tonight. And what really, I would say, it's actually made me think twice about this breast cancer. It's we tend to actually get more than any other race. So please, when you get the letter through the post for you to come for breast screening, can we please take that day off and do ourselves justice by knowing what's going on in our bodies? I know we need money, but sometimes our wealth, our health is our wealth. If you're not well, there's no way that you can function. And we've also been told tonight that some of the cancers, once they get to, once it's detected very, very early, it can be, even if it's not cured, you can be given, more life to live. And also know your body, know what is normal and what is not normal. Let us also learn to study our own breast for changes. So if you notice what is not normal, don't just keep it yourself. That is why we have the doctors, the nurses, and all the health professionals. We are here to look after us. Please learn to study your own body. Learn to, know what is normal and also what is not normal. Any changes, please don't hesitate to call your GP and insist for you to be seen. And I think it will go a long way to save more lives.
Yes.
Thank you so much, Julie, for your time. This education has been really good. I've been educated tonight myself. I've learned a lot from the videos that you shared, from the from the what is it called, the books thing that you showed. What is it called? The
Knitted knockers,
yes, the and also the other one.
prosthesis,
Yes.
and an implant, and my knitted and I go everywhere with my knitted
Everywhere.
boot
Yeah.
and my lemon.
Yeah. Thank you so much. Thank you so much for. I mean, we could go on and on and on.
Yeah.
But thank you. Thank you so much for taking this on. For by being an ambassador for this important area of women's health. And we say thank you for your time, and we appreciate you. And I know this interview will go a long way to save many lives.
Yeah.
So
Thank you
once again, and enjoy
thank
the rest
you.
of your evening. And
Yeah, and
I
thank
know
you
that
for your
anytime I
interest.
call on you again. Yeah,
Yes, please. Yeah.
Yeah. Thank you.
Okay. Good night and
Good night.
best wishes.